Welcome to Easy Medics Daily, where we are learning about Today we will explore its signs, symptom management, and the crucial role of nurses in caring for affected mothers. Pre-eclampsia is a serious pregnancy complication characterized by high blood pressure and signs of damage to another organ system, most often the liver and kidneys. It typically begins after 20 weeks of pregnancy in women whose blood pressure was previously normal. If left unmanaged, pre-eclampsia can lead to severe complications for both mother and baby. Recognizing the signs and symptoms is key to early intervention. The primary symptom is consistently elevated blood pressure. This means readings of 140/90 millimeters of mercury or higher on 2 separate occasions, at least 4 hours apart. Other common signs and symptoms include proteinuria, which is excess protein in the urine. Swelling, particularly in the hands and face, can also be an indicator, although swelling is common in normal pregnancies too. Severe headaches that don't go away with usual pain relievers are a red flag. Visual disturbances like blurred vision, temporary loss of vision, or seeing flashing lights or spots can also occur. Abdominal pain, especially in the upper right quadrant, indicates liver involvement. Nausea and vomiting may also be present, and in more severe cases, women may experience shortness of breath due to fluid in the lungs. Management of preeclampsia depends on the severity and gestational age of the pregnancy. For mild preeclampsia, close monitoring is often the first step. This includes frequent blood pressure checks, urine tests to monitor protein levels, and blood tests to assess kidney and liver function. Rest is often recommended. In some cases, hospitalization may be necessary for continuous monitoring. For severe preeclampsia, or when complications arise, more aggressive management is required. This may involve medications to lower blood pressure, such as labetalol or nifedipine. Magnesium sulfate is a critical medication used to prevent seizures known as eclampsia, which is a life-threatening complication of severe The definitive treatment for preeclampsia is delivery of the baby. The timing of delivery depends on the gestational age and the severity of the mother's condition. In some cases, early induction of labor or a cesarean section may be necessary. Nurses play an absolutely vital role in the management of preeclampsia. Their responsibilities span across identification, monitoring, medication administration, education, and emotional support. Nurses are often the first to identify potential signs of preeclampsia during routine prenatal visits or hospital admissions. They meticulously monitor blood pressure, vital signs, and assess for symptoms like headaches, visual changes, and abdominal pain. Accurate and timely documentation of these findings is crucial for the medical team to make informed decisions. Nurses administered prescribed medications such as antihypertensives and magnesium sulfate, ensuring correct dosages and monitoring for side effects. They are also responsible for preparing for potential complications like eclampsia or a need for immediate delivery. Education is another cornerstone of the nurse's role. They educate the patient and her family about preeclampsia, its potential, risks, and the importance of adhering to the treatment plan. This includes explaining medication regimens, activity restrictions, and what symptoms to report immediately. Nurses also provide invaluable emotional support to women experiencing preeclampsia. This condition can be frightening and stressful. Nurses offer reassurance, answer questions, and help patients cope with the anxieties associated with their diagnosis and treatment. They act as advocates for the patient, ensuring her needs and concerns are communicated to the healthcare team. In summary, preeclampsia is a serious pregnancy complication requiring diligent care. Early recognition of signs and symptoms such as high blood pressure, proteinuria, and other organ damage indicators is paramount. Management strategies range from close monitoring to medication and timely delivery. Nurses are indispensable in every aspect of preeclampsia care, from initial assessment and monitoring to medication administration, patient education, and providing crucial emotional support. Their expertise and compassionate care are fundamental to positive outcomes for mothers and babies affected by this condition.